and has had varicose veins for several years, ever since, I guess, in his later teenage years, you started noticing these developing. Is that right?
Mm-hmm.
Okay. They're now at the point where they've been very extensive, and they're becoming quite symptomatic to him, with some swelling in the leg, heaviness, tiredness, and occasional cramping of the leg, especially at night. And we're getting ready to proceed with the treatment of these. We're going to be doing ambulatory phlebectomy. It's a pretty big vein. It starts from the saphenofemoral junction up in this area, and this is an anterior branch of that saphenous vein coming down to here, and then it becomes more visibly noticeable here along the course of the leg, and then also on the side of the thigh. The main vein along here, which is called the great saphenous vein, is normal in this gentleman. So nothing needs to be done for that vein itself. And our experience tells us that these problems, when they appear like this, and we treat just this problem here in this region, that the great saphenous vein remains normal. Out now about 12 to 15 years, we're seeing this in follow-up. And all this requires is an interruption of the vein at this level. It does not require any incision up here that one would normally see with vein stripping. This is all down here. And what we do is, over the course of this vein, about every 3 inches or so, we make very tiny little incisions, about 1/8 of an inch long. And we can actually extract the veins through that tiny little incision. Thereby, the patient's veins are removed, and the final results are a definite cosmetic benefit over large incisions. We use a light source here that transilluminates the skin, and we end up marking the vein along its course on the thigh. And this is because when the patients are lying down flat during the procedure, the veins disappear. And right now they're kind of difficult to see because they're quite large, and they become more just of a blue-green on the surface. You can actually see the vein in this situation. We can actually just observe it as well, directly through the surface. These veins are quite large, but they present as a shadow underneath as the light is transilluminating through the skin, and we can actually see it. And so I outline it like this. Okay, let's have you bend your knee up. I'm going to bend it forward just a little bit so we can see it here. This is a vein that is otherwise not really very visible in the direct light. The reason why we use this is because when the patients are standing, the weight of the blood in the vein will distort its location with, within the, below the skin. And when you lie down flat, the weight of the blood is much less, or the vein just changes its position. We've pretty much demonstrated this before in patients. And so you can understand that if we just mark this with the patient standing, then the veins can disappear. We can't see them. We don't get an adequate treatment for the patient. Contrary to what is generally agreed that or thought that this entire vein has to be removed, we found in our experience that just interrupting the vein about every 3 to 4 inches is sufficient for this vein to disappear. And with that, the amount of operating time has basically gone from about, perhaps 3.5 to 4 hours dealing with this, with large incisions that have to be closed. Now it is to the point where this may take us about an hour and a half.
empty space, because a lot of the section of vein is actually physically removed. Mother Nature doesn't tolerate empty space, so she puts a little fluid in there. As you go around, your muscles are working and everything, that'll just collapse and everything will look flat and normal. The marks here, they'll come off in a year or so you just you have to make up a good story about them.
Yeah.
And the paper strips will come off usually about 5 or 6 days. 4 days for, remember not to do a heavy exercise that would break into a sweat or cause your heart rate to really go up. After 4 days, if you have a regular routine for exercise, go for it.
Okay.
As of now, walking, driving, stairs, all the usual daily activities are fine. Then in a month, we'll see what that looks like and do a little touch-up with injections if there are any places that aren't fully shut down. It looks pretty complete.
All right.
All right.
Feels good. Yeah. I don't really feel much at all.
Okay.
I mean, the first couple of weeks it was bruised feeling, you know, and when I'd kneel on it, it would hurt and that sort of thing, but it's good now.
Well, good. Well, I see that smile on your face. That's the vein right there.
Okay.
That's closed. See, we got into this without having to do anything more.
Okay.
But the main vein up here, that was big like that,
Yeah.
coming in as a junction right there, it stops. It's the normal vein going off that way, coming in and then going down. That's closed. And then it's closed all the way down.
All right. Yeah.
And that'll absorb with time.
Mm-hmm.
So it's about that long. And so our decision making was such that, you know, our experience tells us that we just leave that alone. And everything else is looking pretty good.
Yeah.
These are going to go away too. They're lumpy. Anything that's lumpy and firm is going to smooth out. Makes a big difference.
Yep, it definitely does.
Chances are really very good that this is going to stay this way. And we're going to follow you again in about 3 months. Make
Yeah.
sure everything's all right, and then the veins up in the thigh are working okay and don't come back or sneak back or open up. You'll find that if you've got the varicoses remaining in the thigh area, that they need to be addressed, even though they may not be symptomatic, because those are the ones that can lead to reoccurrence of the varicose veins pretty quickly, even though they may not be visible. And if that's the case, we'll do sclerotherapy on you. But right now, everything is looking good.
Okay.
And we anticipate it's going to be this way. When I see you again in 3 or 4 years after that, you're going to be along too.
All right.
Okay.
Sounds good.
All right.
Yeah, it looks good. I'm happy with it.
Okay.